Friends, my name is Dr. A.G. Unnikrishnan. I am endocrinologist and CEO at the Chalaram Diabetes Institute, Pune. Today at the Research Society for the Study of Diabetes in India's annual Congress in Chennai, I have been speaking about and I am to speak about GLP-1 analogs. The incretin system has been extremely fascinating ever since the discovery of intestinal factors that release insulin secretion on food intake, and these intestinal factors that release insulin secretion on food intake are called incretins. Incretins can be taken as oral pills as well as injections, and essentially they cause a glucose dependent increase in insulin secretion. This means that when the blood glucose levels are high, they increase the insulin and switch off the glucagon, and when the blood glucose are low, they switch off the insulin and switch on the glucagon. This means that glycemic peaks and valleys are minimized. There is very little hypoglycemia with these agents, and this degree of control with the injectable incretins called GLP-1 receptor agonist, glucagon-like peptide 1 receptor agonist, means that the blood glucose level control is very good. In addition, the GLP-1 injections also help to prevent weight gain and even may cause weight loss, and some of these GLP-1 receptor agonist therapies are daily injections, some are oral pills, and some are once a week injections. Now, it's very important to know that GLP-1 receptor agonist therapies not only protect against high blood glucose levels, not only do they lower blood glucose levels, they also protect against cardiovascular disease. So therefore, it is hoped that people with GLP-1s, whether it is the injectable daily GLP-1, the oral GLP-1 which is semaglutide, the once a week GLP-1 which is dulaglutide, these medications when used as an adjunct to diet, exercise, other oral drugs, when these therapies are used, they are weight friendly, they control blood glucose levels, and they may always offer some degree of protection. Not always, but they do offer protection against cardiovascular disease, and therefore using these therapies in the right way will help people with diabetes, type 2 diabetes, protect themselves not just from glucose related complications but also macrovascular complications such as cardiovascular disease. It is hoped that the appropriate use of GLP-1 receptor agonists along with diet, exercise and other medications will be able to reduce glycemic variability, control HbA1c levels, prevent diabetes related micro and macrovascular complications, and therefore they bring hope of health to the millions of people who suffer worldwide with type 2 diabetes, promising them health and wellness. Thank you so much for listening to me.